Hi everyone, today we are going to talk about breast cancer, and as we all know that there is a significant increase in incidence of breast cancer in our country, and the incidence is mainly seen in urban population, but we also see that there is a lot of patients with breast cancer in rural India as well. And cancer is one of those difficult journeys, not only for the patients but also for the persons who are looking after the patients with cancer. So as a professional, I would request all the healthcare professionals to provide proper information to our patients, which goes up with the current evidence and the guidelines, what would be appropriate for our patient population. So the idea behind this health tip is mainly to make sure that we improve the awareness of screening in our population. Why breast cancer? Why do we need to talk about the breast cancer screening? Because as I was mentioning earlier, there is increased incidence of breast cancer, and we are also seeing that more younger women are affected compared to the older women which we were seeing in the past. When I mean younger women, women between 30 to 40 years of age seems to be more affected compared to what was the picture 20-30 years ago. And also the cancer, when we see the cancer in these population where the women are between the age of 30 to 40, they seem to be more aggressive. Aggressive means they take from the onset of the symptom to the picture, or when they come in to see the doctor, the cancer has grown to such an extent where the treatment may not be possible at that point, and it's only a palliative treatment. So from our end, identification at early stage is very important. That's why we talk more about the screening. What I mean about screening is to identify the cancer symptom at early part so that we can start the treatment early on in their life, and then the survival rate is pretty good in those patients with breast cancer. Unfortunately, the screening is not across all the population in our country, and the awareness of the screening is also minimal. So as a family physician, I think we all play a huge role in talking more about the screening, telling them the importance of screening. So any woman above 20 years of age should be able to examine their breast themselves on a regular basis. This is called a self-breast examination. As a clinician, what I always do is when I see a patient, any female patients, when they come for a normal consultation, we discuss about self-breast examination, which is a very, very simple procedure where the idea behind the self-breast examination is so that women are aware about how their breasts normally feel, and if they do it on a monthly basis, once a month is more than enough, they will be able to get some idea about their breast. And then if anything abnormal, let's say a mass or a lump or even any change in the skin, they will be able to identify at early stage and come and get the help from the doctor. Also, there is something called as mammogram, which we recommend for patients who are about 40 years of age on a yearly basis. So all women above 40 should have the mammogram done once a year. This is more like an X-ray, but an extended format of an X-ray, where it takes about less than half an hour in majority of the scenarios, but it helps us to identify at early stage. Unfortunately, as I was discussing earlier, there is no screening in our place for all women, so it's mainly on the personal basis. Some patients come, discuss about it, and then have it. So as a doctor, I have taken a step that I discuss with all my female patients to do a regular mammogram, and we nationwide, as a part of our regular consultations, all the doctors emphasize on the screening, because preventive health always helps compared to having the disease later on when going through the treatment. Early we identify, better the treatment is, and the survival is better. So if you have any more queries about breast cancer and breast cancer screening, you can always look into our website where we will have more information, and there will also be a video or YouTube video clip on self-breast examination where you can go through the information. So for more details about breast cancer and screening, please do look into our website. Thank you.